Dear viewers, now we'll be learning about another angiogram. And this angiogram, here we are looking at the superior mesenteric artery and its different major branches. Superior mesenteric artery is one of the ventral unpaired branch of my abdominal aorta, and this superior mesenteric artery is given at the level of first lumbar vertebra. As for any other angiogram, we have to insert a catheter into this superior mesenteric artery, and you can see in this image the catheter has been shown up. I'm just highlighting it. So you can see the location of the catheter, which has been used to inject this contrast material into this given angiogram. Now let's highlight, and there you can see I'm just highlighting the different branches given by my superior mesenteric artery. This superior mesenteric artery is the artery of midgut and its derivatives. The structures who are developmentally coming from the midgut, they all get their blood supply from this superior mesenteric artery. And now this first branch, which you are looking at in this location, there you are looking at this branch. Let me label it. So we are looking at the middle colic artery. And above to that, if you pay attention, let me use another color for that. There we can see inferior pancreatico-duodenal artery. Inferior pancreatico duodenal artery. And then after that, we can see one of the major branch, and that's my right colic artery. This right colic artery, as you can see here, it is going and supplying to my ascending colon. And there you can see more branches from my middle colic. And then going down further, you can see another branch which is coming from my superior mesenteric artery. And this branch, I can make it like that. And this is nothing but my iliocolic artery. So iliocolic artery is going and supplying to the cecum and to my appendix by giving appendicular artery, and also it gives posterior cecal arteries. And you can see all of them, they has been shown. And then you can see numerous you can see these numerous branches which are coming up from my superior mesenteric artery, and they are going and they are supplying what? All of them are going and supplying my jejunum and ileum, and they are known as jejunal and ileal branches. You can see them, all of them, they are going and supplying to the loops of my jejunum and ileum. And these are being shown up here in the form of this mesh of these numerous tiny branches, and primarily they are going to the first to the jejunum and then to the ileum. And now if you focus on this right side, you can see these numerous tiny branches which are coming from my ileocolic, my right colic. And what are they doing? A pattern is being formed. And if you pay attention to this pattern, and this pattern which is being formed on the right side, and you can see this pattern continues even superiorly. And this pattern is what? I use two different colors for that. This is my marginal artery of Dermond. And what is this marginal artery of Dermond? It's an anastomotic ring. And on the right side, you have seen it's been contributed by what? By my middle colic, right colic, ileocolic arteries. And then on the left side, it will be contributed by my branches of my inferior mesenteric artery. And that is formed around the margins of the colon. And they are making collateral circulation. And when considering, once we are going for partial colectomy, so this marginal artery of the Dermond is there for a support. Let's summarize. Superior mesenteric artery is given at the level of first lumbar vertebrae. It is one of the ventral branch of my abdominal aorta. This is the artery of midgut and its derivatives. And it gives primarily branches, and these branches are inferior pancreatico-duodenal, middle colic, right colic, ileocolic. And then on the other side, it gives multiple branches to the loops of my jejunum and ileum. And then on the right side, these branches are contributed in making one half of the marginal artery of the Dermond. Thanks for watching.